I'm KCorazzini. I'm an associate professor here at the School of Nursing. I am actually a social gerontologist by background, and as such, I've always been interested in the different roles in licensure that are related to providing nursing care, especially in long-term care. The theoretical framework for the study is actually really rooted in Abbott's systems of professions, and he really posited that in any core set of work to be done, that there's actual competition among different disciplines as to who has that professional expertise to really establish jurisdiction over how those core tasks are organized and performed. So, early on I began to wonder, even though we say nursing home, where are the professional nurses? Do they really have ultimate jurisdiction about how care systems are organized in nursing homes? Instead, what we see is we see nursing home administrators who nationally actually are unlikely to be prepared with any kind of clinical degree. It's typically a healthcare management or administrative degree. The majority of nursing home the majority of care that nursing home residents receive is actually not at the hands of the RN. So it made me think about all these different kind of disciplines and kind of players in who's really driving the care structures in that nursing home, which ultimately led me to think more systematically about scope of practice and who's driving the care systems. I and my research team colleagues, including Drs. Ruth Anderson, Dr. Ellie McConnell, and Dr. Nancy Short here at the School of Nursing, along with Dr. Dick Landerman here at the School of Nursing and at the Medical Center and the Aging Center, are along with collaborators at the University of Minnesota and the University of Wisconsin School of Pharmacy, are trying to understand the implications of differences between states in how they regulate nursing scope of practice, and most specifically RNs and LPNs, and the potential impact of those differences on quality of care for nursing home residents. So we have just completed a first round of funding by the National Council of State Boards of Nursing, where we actually went through and collated all the state nurse practice acts and went through and read them and coded each state in relation to how they how scope of practice is defined for the RN and then for the LPN. And from that, we were able to look at the relationships between those state differences and characteristics and the Centers for Medicare and Medicaid Services quality measures for nursing home care. So what we're finding, for example, is that states that are more restrictive in how they regulate scope of practice for licensed practical nurses actually have better outcomes than states that are more permissive in what they allow LPNs to do. So, for example, states that allow LPNs to both supervise and delegate, which are two key core processes that we typically think of as part and parcel of the nursing process and therefore part of what an RN does, states that allow LPNs to do that in nursing homes actually have, are on average, have poor quality care outcomes for nursing home residents. And by quality care, I mean looking at a composite index of a variety of adverse care outcomes that we don't want to see in nursing home residents, such as decubitus, moderate to severe pain, worsening mobility. So now what we're really interested in, we just are starting our next phase of funding from the National Council of State Boards of Nursing, and now we're trying to understand, okay, as we work through and we know how the boards of nursing at the state regulate scope of practice. So can we now talk to nurses and hear from, in their words, RNs and LPNs, how they're actually enacting their scope of practice in the nursing home. So if we say a state allows an LPN to delegate and supervise, what does that actually mean for practice patterns that LPNs are actually doing in the nursing home, and RNs as well. So we can better identify optimal nurse practice patterns to design ultimately an intervention to improve resident care outcomes.